Welcome to Grand Rounds, the Healthcare Dollar, patient story time. All of the details of this have been changed and are de-identified. I had a patient 1 week ago present when I was in procedure clinic. He was a 49-year-old male, otherwise healthy. He presented for a pretty big excision of a lipoma. Now, for anyone who doesn't know, a lipoma is a benign nodule. But the problem with his is that it was very large. It was over 8 centimeters or so. And it had previously been removed twice and had come back, which is somewhat unusual for a lesion of that type. So, in addition to just taking out the mass and stitching him up, we also wanted to get an MRI. It was the medically correct and necessary thing to do. The kicker, this patient did not have insurance. He and his wife made $4,500 combined. They worked as plumbers, and she was also an artist on the side. And he made too much money to qualify for our local county assistance program, JPS Connect. And he was also too rich to be on Medicaid automatically. However, he was not rich enough to buy healthcare insurance, which, when I asked him what the market rate going was for a decent plan that providers would actually accept, for him and his wife, it was $500 a month, which would pretty much amount to greater than 10% of his salary, and it was something he couldn't afford. So him and his wife didn't buy health insurance. And now he had a medical problem. Now, if it was just a matter of taking out the mass, it might have been something we could have negotiated a cash price pay for. However, he also needed this MRI, which basically left him to scramble around calling about cash price options for MRIs all across the DFW area. Fortunately, we were able to make some suggestions and give him some guidance, but essentially this patient had to be left to his own devices to figure out how to get an MRI so that he could come back and see us, because as physicians, we couldn't in our good conscience just take this mass out without getting some kind of imaging. That's the US healthcare system for you.